I am Lynn Kinst, Executive Director of the Hemophilia Council of California, and I want to welcome you to our webinar this evening, the CDC and Your HTC. And so we are going to get started. Briefly, we just wanted to thank all of our sponsors who provide support for our advocacy and public policy webinar series. For those that are new to our organization, we do these about once a month. And this year we are talking about, or this month, I should say, we were talking about the federal changes. Just a reminder that we are neither the Hemophilia Council of California nor our speaker this evening are providing legal counsel or medical advice, and we are recording this webinar to post it at a later date. So the recording will be made available as soon as we can get the video edited. Again, I know we have some folks joining us who may not have been with us in the past, so I wanted to just briefly introduce the Hemophilia Council of California. We're a nonprofit organization here in California who coordinates the advocacy agenda of our 4 California hemophilia organizations. Our focus is really access to care, education, and advocacy as it relates to health policy, with the goal being that all individuals in California living with bleeding disorders, as well as even other rare and chronic conditions, have an improved quality of life. All right, so with that, I want to jump right into our topic. I will note that while we typically try to keep these to 30 minutes, this topic this evening is so important and somewhat dense, and so I suspect we may run over a little bit. I hope that you're able to hang with us to the end, because at the end we will be providing information regarding how you can take action about these issues, and we will be following that up with links tonight or tomorrow morning, first thing, to some documents that we've prepared to help you guide you in your advocacy efforts. But with that, I want to introduce my co-presenter. Dr. Amit Soni is the Principal Investigator and Regional Director of the Western States Regional Hemophilia Network, as well as the Medical Director at the Center for Inherited Blood Disorders in Orange County. So, Dr. Soni?
Excellent. No, thank you everyone for joining us tonight. I know we have some people on the East Coast as well. Thank you for staying up later. Many of you may know the next couple of slides, but we just want to stress the importance of the Hemophilia Treatment Center. It's not just the physician that writes the prescription for your medication, but really it's the group of people that care for patients with bleeding disorders. Your core team is your physician, your nurse coordinator, your social worker, your physical therapist, and we all provide expert care for those with bleeding disorders. We also are critical in diagnosing patients that have yet to be diagnosed. Our goal is to provide individual treatment plans and really create a provide a treatment plan that prevents bleeding from occurring, but also provides guidance when issues do arise. So the US Hemophilia Treatment Network was actually authorized in 1975. So
I try not to ask because their other grandparents asked all the time.
oh,
Sorry, if you could please
Yeah.
mute. We're hearing some background conversations. Thank you.
They're very nosy, yeah. Actually, I'm going to put them in the web. I'm going to open that one and put them in there. Yeah.
thank you. So yes, I am actually older than the Hemophilia Treatment Centers Act of 1975, which is humbling. But that helped provide federal funding to establish a network for comprehensive care centers. In 1982, the CDC Hemophilia Surveillance Project began, and it was really in response to the bad blood crisis that some people know as. Whereas in 1982, the first US case of AIDS affected patients with hemophilia because of contaminated blood products at that time. And we don't want to forget that over 60% of the US people with hemophilia contracted HIV by 1988. So the hemophilia treatment network was designated as a quote covered entity in 1992, and it's key because it helps us allows us to participate in the 340B program, which we'll talk a little bit more about in a future slide. In 2003, an assessment from the CDC's Hemophilia Surveillance Project showed that there were no new infections related to blood products since 1998. So it's very important for us to maintain this vigilance and surveillance to provide safe products for our patients. The Affordable Care Act in 2013 also further designated us as an essential community provider. So you can see the Hemophilia Network is critical to providing expert care throughout the country. And we serve rare bleeding disorders, clotting disorders from hemophilia, von Willebrand disease, platelet disorders, Glanzmann's. We serve through the whole network about close to 50,000 individuals were served in the network in 2024. The country is split into 8 different regions. Us in California, we're part of the Western States region, but there are 149 centers across the US, 10 centers here in California. Now, what we've been able to show with this network, and we're really a great example that HRSA likes to use in showing what can be done with federal funding and a coordinated effort, is that we've actually shown, to the last point, a 40% decrease in patient mortality among patients with hemophilia who are treated at hemophilia treatment centers. That coordination of care is critical for patients. In addition to that, we also like to make sure that we're meeting the needs of the patients. So 95% of the hemophilia treatment patients, percent of patients said that they were always or usually satisfied with their hemophilia treatment center team and the care that they provided in a 2023 survey. And again, our numbers are growing, and we have had more than a 40% increase in the number of patients in just over the past 10 years. We don't want to lose ground on the gains that we've made thus far. Hemophilia Treatment Center funding has various components. Reimbursement from patients and payers through different insurances. We're also part of the HRSA, or the Health Resources and Service Administration grant. We are under the Maternal and Child Bureau, known as Special Projects of Regional and National Significance. So in addition to that, we are also part of the CDC Community Counts projects. And the CDC's Division of Blood Disorders and Public Health Genomics helps us monitor data on a community basis throughout the country. And we'll talk a little bit more on the next slide about the 340B program and how that is important for hemophilia treatment centers through participating in the HRSA grant.
Yeah, and I just want to note that really the most substantive amount of the funding comes from the first and the last bullet point there. So the reimbursement from various payers and the 340B program income. We're going to talk about why these 2 grants are so important, but they really don't make up a significant portion of the overall funding of the HTCs.
So for the HRSA grant, HRSA, again, there's 8 regions, and there's a regional core center for each of the regions. So here in the Western States, Center for Inherited Blood Disorders is the regional core center. And what we do is we then disperse funds to other hemophilia treatment centers within our region. Our region includes California, Nevada, Hawaii, and Guam. And our responsibility is to make sure that those hemophilia treatment centers utilize the funds for the best needs of the patients that they identify in their unique populations. So the needs for us in Orange County, California, are different than our colleagues in Nevada or Hawaii or in other areas. The grant is a 5-year grant cycle. Currently, we're coming up towards the end of grant cycle year 3. So grant cycle year 4 starts in June. And although the amount of the grant has not increased in the past 20 plus years, what it does allow us to do is participate in the 340B drug pricing program. And what we're able to do is sell hemophilia treatment products at a lower cost, and the funds that we're able to generate go right back into the hemophilia treatment care that we provide to our patients, as well as supporting a robust multidisciplinary team that takes care of the patients. You may have heard a bad rap about 340B in general. There's different 340B programs. There's the DISH 340B programs that hospitals utilize, and they do not need to track where their funding goes. But for those of us in hemophilia, at our hemophilia treatment centers, we have a different designation of 340B called the HM designation, and that requires stringent monitoring of where every dollar that is gained as program income is utilized to benefit patient care and patient access. So we are very transparent and have strong accountability, and we have good fiduciary responsibility of the funds that we're able to generate through this federal program. Now, the CDC, many people are aware, is the Centers for Disease Control. It's their national public health organization, and it falls under the Department of Health and Human Services. CDC's mission till now has been to protect Americans from health, safety, and security threats. On April 1st, there was a reduction of 2,400 jobs in the CDC itself. There was larger workforce reductions in the Health and Human Services, which CDC is a part of. You may have heard statistics where there was 1 in 5 employees that were let go. But when those cuts come in larger divisions, it has a significant impact. So for our division, the CDC's Division of Blood Disorders and Public Health Genomics, all but 2 spots were eliminated. So essentially eliminating almost all of the division. And by cutting this division, people with bleeding disorders have lost critical services, impacting the safety of and the access to treatment and care, which is what brings us together here tonight. So the CDC Division of Blood Disorders has the Community Counts, which is the public health monitoring program. It was created in response to the bad blood crisis in the early 80s, and really its purpose is to gather information and share information about health issues, medical complications, and causes of mortality for patients with bleeding disorders. The data group that it partners with is ATHEN, the American Thrombosis and Hemostasis Network, and we work with them as part of the US Hemophilia Treatment Center Network. So really, it's unifying all this health data and really looking at ways that we can improve healthcare outcomes and make sure that it is a safe environment for those of us that are in the bleeding disorders community. These data have advanced scientific findings and progresses, and as I stated before, a 40% reduction in mortality. In addition to collecting surveillance data, the CDC also provides laboratory surveillance data, looking at safe products in the bleeding disorder community. In addition, it also provides laboratory services, particularly inhibitor testing, which significantly will impact our rural and underfunded regions. So it's critical that we identify patients that have inhibitors and make sure that they're on the appropriate treatments that are necessary. Again, the CDC lab helps ensure the safety of treatment products for bleeding disorders and through surveillance for emerging bloodborne pathogens. So
Sony?
in addition to, I know many people may be wondering that a lot of products are now recombinant products, but the blood supply that patients may need may include transfusions during surgeries, during accidents. So we really want to make sure that the blood supply in the US remains monitored for future pathogens.
Couple of questions that have popped up in the chat. So I thought maybe we'd pause here, Dr. Soni, and I can give those a shout out. Given the dramatic and short-sighted cuts at the Center for Blood Disorders, is there any sense in the provider community that this important work can be restored in the future?
No. So we've met with different leaders in the from HRSA. We've met from different leaders within our national hemophilia, the National Blood Disorder Foundation. We've met with partners from the Hemophilia Alliance and others. And what we're hoping is that they can restore the function of the labs. I don't necessarily know if it's going to fall under the Center for Blood Disorders. Looks like the current administration has a different viewpoint on what CDC's role should be. But what we want to advocate for is the restoration of these services that were previously provided and really to educate folks on how important it is that these services remain intact.
Absolutely. And we're going to get in a little bit to sort of more discussion about like how we can reach out to our Congress members and how we want to kind of phrase those things and word them in order to try to see some of these services restored. Katie, we're going to get to your question in just a minute. I want to just let you highlight one more time this blood safety piece, Dr. Soni, and then we can have a little bit more discussion about what you've shared before we move to the related topic.
So the cuts included the HHS, Health and Human Services, disbanding the Advisory Committee on Blood and Tissue Safety and Availability. And that's the Federal Advisory Committee that provided guidance to the HHS Secretary on policy issues related to safety and availability of blood products, tissues, and organs. So I want to be clear because I see another question about blood supply no longer being monitored. It's just no longer being monitored by the people that had been monitoring it before, and the people that have been advising the HHS on how best to monitor it. So we want to make sure that there's no gaps that develop when the people that have been doing it for such a long time are no longer part of the process. So we want to ensure that the process remains intact.
Thanks, Dr. Soni. And then there was another question from a patient in Colorado. She is stating, and I'm pretty sure this is accurate, that there's only one HTC in Colorado, and she's concerned, like, are these changes putting the HTCs at risk? Is there a chance that some of our HTCs might be forced to close because of these changes?
Yeah, no, it's a question that everybody's asking. And, what I can tell you is we just met with the HRSA leadership yesterday in a meeting. And again, I think we're all learning what cuts are happening all at the same time. But right now, they want us to continue with the 340B program as envisioned, as currently being practiced. They want us to continue doing what we're currently doing. We want to make sure that a lot of hemophilia treatment centers utilize the 340B program to really build their team that can then provide the services to the patients. And what we don't want to happen is for them to, the question I asked is, how do we shine a spotlight on the fiduciary responsibilities that we've done with our 340B and highlight all the successes that we've done and how critical we are to the community, but not necessarily generate enough heat where it draws so much attention and scrutiny. And their reply back was, we need to educate our congressmen, our congresswomen, our leaders in the government on how critically important the 340B program is, how critically important the hemophilia treatment centers are. We'll get to that with the last few slides, but right now there has not been cuts directly to the HRSA office. The HRSA division is going to fall and be merged with 4 other divisions and form this new Administration for a Healthy America. Now, once that new administration forms, I don't know if then they'll look at any trimming options. What we want to make sure is that the HRSA grant remains, because it's through the HRSA grant that we're able to do the 340B program. And we also want to make sure that the 340B that is provided by the hemophilia treatment centers is not lumped in with things that are being done by larger hospitals through the DISH program that isn't required to have as much stringent oversight as we are. So we want to highlight through good fiduciary responsibility that we have the same goals as the administration of we want to utilize and maximize all the resources that we can and not abuse anything. So we want to make sure that our 340B section, which is smaller in the big pool of 340B that's mostly driven by hospitals, we want to make sure that we're able to highlight our strengths and our importance in the community that are different than some of the interests of larger hospitals.
Excellent. I touch on a couple of related issues. So the 2 other issues that we wanted to touch on tonight are not directly related to the CDC or HRSA. What we really hope that we have been able to do and accomplish is give everyone kind of a good overview of how those federal programs have historically worked to support our HTCs and help provide excellent comprehensive care for our community, and then what specifically has been cut. And then in just a moment, we're going to get into what can we as community members do about this to try to see if we can get those services and functions restored. But it felt to me like it would be an oversight if we didn't touch on these other 2 issues that if you're following healthcare at all in the news, I'm sure that you have heard about. And so the first is the issue of pending cuts to Medicaid. So Medicaid is the federal program which provides essentially insurance coverage to, in most part, children, disabled, and then lower income individuals. In California, we call that program Medi-Cal. That is our specific name for it. But again, this is a program that is funded in part by the federal government. The federal government provides guidelines, and all 50 states participate in this. Pending proposals in Congress, you may have heard the number $880 billion is one of the numbers that they're looking at potentially cutting Medicaid by. That in California alone could be up to $20 billion annually. Nationally, around 30 to 40% of our bleeding disorders patients receive their care through Medicaid. In California, that number is closer to 50%. And in some states, these changes could result in the immediate loss of Medicaid. And really and truly, Medicaid supports many of our providers in a great sense. I was reading an article just earlier this week about a children's hospital in Riverside County here in Southern California that 89% of their income comes from Medi-Cal in California. So if that is cut significantly, it's very possible that the people in that region could lose that hospital altogether, even if they are one of the private pay patients that has received services there. So Medicaid is definitely an issue that we also want to reach out to our Congress members about. And there's additionally an issue with the ACA enhanced premium tax credits. So these are credits that made it easier for people who were on the Affordable Care Act to be able to access insurance. And these enhanced premiums expanded the eligibility to those whose incomes are 400% above the federal poverty level that previously had been ineligible. And it significantly reduced premiums for many of these, with a large percentage of enrollees having a premiums of less than $10 per month. So again, this is another issue. And because these are credits that could expire, or will expire, that's what we call a sunsetted provision. The Congress has to act proactively to extend these so that they would continue into 2026. Okay, so we have a couple of questions in the chat, but before I hit those, I want to get into what we can do about this. So, a few different ways that we can take action in order to attempt to influence what is happening at the federal level. So, first of all, contact your member of Congress and the U.S. senators from your state. That would be the top issue. I would also encourage folks potentially to contact your local state legislators. Particularly if you already have a relationship with them, you can contact them and reach out to them and encourage them to reach out to their colleagues in Congress. They may have existing relationships with members of Congress. And then we can also do things like post on social media, submit letters to the editor, and get on lists so that you can stay informed. You can get on the HCC list. You can get on to NBDF or HFA's list, and they are also providing a lot of updates on these issues. And I know some of you might be like, okay, well, what am I supposed to say when I talk to the congressman? And so there's basically three concrete messages that we want to have. We want to reestablish the Division of Blood Disorders at the CDC, and even want to refine that a little bit. Like Dr. Soni mentioned, at the end of the day, it doesn't have to be at the CDC. If they are going to reorg some of these, some of the offices, that's fine. But what's critically important is that these functions continue. So it's critically important that community counts continues. It's critically important that we're doing surveillance of the blood supply and that we have a way to have an advisory committee to address those policy issues. If they want to put it in another division, that's fine, but we want those functions reestablished. And then ultimately, the other two, the messages are very, very simple. Save Medicaid and vote to extend the enhanced tax credits. So with that, I do want to pause a little bit and address some questions in the chat. Also, please feel free to unmute or raise your hand if you have a question or a comment while we're addressing some of the questions here in the chat. So Heather asks about GHPP. For those that aren't familiar with that, GHPP is the Genetically Handicapped Persons Program. It's something that is here specifically in California. And so none of the federal changes directly impact GHPP because that is entirely a state program and it does not receive federal funds. I think the concern is that if the federal government significantly cuts funding for Medicaid, then um, we could see issues with the state then feeling like they need to make cuts with GHPP. I hope that is not the case. We will certainly be monitoring that and fighting to protect GHPP, but that's where there could potentially be a trickle-down effect. I don't think that's something that we would see this year, but it could be something that we see in out years if we have, significant budget deficits, because of federal cuts. Um, we also um, are have a question here. Let's see. I want to make sure we address all these. With the cuts to the CDC, do we know what will happen to the data that has been collected for many years by the HTCs and the blood samples as well? Dr. Soni, I don't know if you're available to speak
Yeah.
to that.
Yeah, we don't know what's going to happen with them. We're hoping and advocating that the data that has been collected remains available for review and for learning from. We also are hoping that the blood samples also remain. I don't know if there's going to be additional collection of the data or of the blood samples, but we're hoping that what's been collected so far remain, but that has not been confirmed so far.
Yeah. So I know that the folks at AFIN and the folks at each of the regional core centers are working, very hard to continue to work on that issue as it relates to the samples. So that is something that we can continue to advocate on. Let's see. Regarding the manufacturing of Humate P, is it created using living donor blood? If there is a limited blood supply, does that impact how much Humate P can be manufactured?
Yes, P is a plasma product, and it would be important to continue to remain the surveillance. So thank you for bringing that up. I know I mentioned more of the recombinant products, but you're right, there are other products that are plasma derived that we do want to ensure are still continue to be monitored. Great.
Yeah, and I would add to that just two quick comments to help everyone have context, and that is that um, medications that are made from plasma are collected in a different process than blood donations and plasma donations that are collected and then given as whole blood and whole plasma transfusions. So those centers um, are continuing to operate the same way that they were at this point. And they have the same standards in place. So we do definitely need the monitoring, but it is in their best interest to continue to use the best practices that they have in place in that process. Now, if we see a reduction of plasma donations, that's where, at these collection centers, that's where you could have potential disruptions in availability of product. I have not heard of any immediate concerns about that, however.
Yeah, I have not heard of any reduction of plasma donations as well.
Yeah. Um, So, Ryan, I see your comment, but part of the question seems to be cut off. And I know it is frustrating that we have to go and educate folks and, remind them about these successful programs. It's discouraging that we feel like we might be taking some steps backwards. And so, but I think, we've had a long history in our community of being amazing advocates, and that's how we've gotten to where we are. And so I would encourage folks, let's continue that great work, moving that direction. I don't know if you wanted to clarify that comment or add to the part I couldn't see, Ryan.
Um, Hi everyone. Sure. I think I agree, Lynn, with you 100%. I think it would be it would be helpful if we could when we're meeting with people at HHS, that we could be somewhat direct though in sort of the way that we advocate for the preservation of these programs. And we could even reference the fact that, we've been, educating and highlighting the success of these programs like for decades. And so like every time the community meets with Congress or meets with a state legislature, that's always part of those discussions is talking about the, successful programs that go along with the access to treatment.
Yeah, absolutely. And um, so that leads kind of into Bill's comment as well as what I want to share, and that is that um, so so that the cuts have been taken by administrative action. But what we have seen a lot from the current administration is that, some massive sweeping changes will come through, and then sometimes some of those end up getting rolled back because there's an outcry, right? There's people who explain like why that was problematic. So, we need to share that story as publicly as we possibly can and draw attention to the fact that this needs to be restored. I mean, I think that the folks at HHS in the mainstream of HHS, they believe in these programs and are familiar with them. It's the very upper levels of the administrative leadership that need to hear this from us and members of Congress who can start asking questions. Um, Bill pointed out May 7th is the start of the budget reconciliation process in the US House Energy and Commerce Committee, which will really be the first look at what they're proposing specifically to Medicaid. And so now is an excellent time to be reaching out to members of Congress and encourage them not to accept these draconian cuts to Medicaid. And we are not just giving you these couple little talking points. So we have created, and I'm actually gonna switch what I'm sharing here real quick. Uh, Maybe if it will let me. Um, and show you the documents that we're gonna send to you. Okay, here we go. Okay, so we are going to be sending out an email with links after this webinar. And one of the documents is how to be an advocate. And it's going to take you step by step through the process. Okay, so it's going to give you 4 options. You can call their office. You can schedule an in-district meeting, meaning you can go to one of their district offices that should be fairly close to where you live. If you can't get a meeting, you could do a drop by, meaning you just come during regular business hours and drop off some information. And then you can also submit your comments via email. So this document is going to take you step by step through how to do each of those things if you are not familiar with how to do this advocacy if you haven't done this before. And then we have 3 leave behind documents that serve 2 purposes. They educate you on the issue and kind of reiterate some of the things that we tried to talk through quickly tonight. And then they also summarize, they can also just be given to the member of Congress when you speak to them or to the staff, and they summarize the issue. They can then become familiar with the issue themselves. It gives the request, what we're asking from them at the end, and it also has contact information. So if they have questions that you can't answer, you can just send them our way, and we can share that information with them, with them, excuse me. And then we also have one on Medicaid and one on the enhanced tax credits as well. So you will be getting those documents. Um, very shortly via email with links. And we hope that that will really help you kind of work through how to go about doing this and what you can share with people in leadership and power in order to hopefully reverse that. So a couple of things on that. If you did not sign up via the website for today's webinar, like if someone passed along the information to you, and so you didn't directly sign up, be sure to direct message Andrea your email and name so that we can send you that resource that we just talked about. And so um, let's see. Oh, and then yes, there is a Melissa's comment. A great job going to DC last year with your son to advocate. That's awesome. So the document that we're sending out will be a PDF. But I have offered to all of my colleagues across the country with other chapters that if they want me to send it to them as a Word document, so they can kind of put it into use it for your state information at your local chapter. I'm happy to share that. So feel free to reach out to me or have your chapter reach out to me if you would like to do that. And then Katie, your question on studies continuing. Um, so there are studies that may be delayed or stopped temporarily if they're being funded. I know across healthcare studies at NIH, for example, the National Institute of Health, people have lost grant funding and some studies have paused. There are a lot of studies in blood disorders and in bleeding disorders that are being funded by various different academic and pharmaceutical entities. Those are at this point all continuing. That research, those clinical trials are all ongoing. And so I think we are lucky, for lack of a better way of saying it, in this community that we do have a lot of organizations and private entities that are interested in doing research. And so at this point, those things are continuing. I don't know if you wanted to add anything to that, Dr. Soni.
Yeah, most of the clinical trials are not necessarily funded by the NIH or the CDC. So the bulk of the clinical trials for bleeding disorders will continue on.
Yeah. Yes, Heather, please do. I'm happy to send the materials to Perry. If you want to reach out to me or send Perry and I an email together and we can get that conversation going. Um, yeah, and I think Melissa, I think we answered your question hopefully about clinical trials. So, yep, I see the okay sign. So, um, well, I do want to, we're all definitely over. I'm happy to stay on for another few minutes if you still have questions. We do want to again thank our sponsors that make our webinar series possible. And I will leave up this slide for a little bit with my contact information in case you have follow-up questions. Also, you will be getting an email from us. And so you can also reply to that email as well. And lastly, I do want to note that we have our as part of our regular webinar series, our May webinar will be on the 21st. And I believe at this point that our plan is to focus more on the Medicaid piece and whatever the latest news at that point is here in California and probably also a little bit of across the nation. And also then if there are any updates to be shared on the topics that we talked about earlier related to, HRSA or the CDC, we'll probably also share those at this time. So if you did sign up today, then you should have gotten added to our email list and you will get the information about the May webinar. Please sign up for that and share that amongst others that might be interested in this topic. And we really appreciate your interest and your advocacy. I kind of skipped over it on that one last slide, but I would just remind everyone, be kind to yourselves, take care of yourselves. I know that for many of us, this has been a very scary time. And so I would encourage you that even as you advocate and seek to stay informed, that um, you do that in a way that protects your own mental and emotional and physical health. and that you step away if you need to. And we as a community will continue to advocate for one another as we go through this process. And so with that, I will say good night, but I will stay on for a moment if there's any last questions. Thanks everyone for joining us.